Thank you for joining our Employment Seminar Series session today. Retain Kentucky, providing quality employment services to people living with asthma. I am Kimberly Wickert from the University of Kentucky Human Development Institute and Retain Kentucky. My preferred pronouns are she, her, and I'm a mid-career white woman with blonde hair and glasses. I'm wearing a blue sweater and have a blue holiday background with UK and Retain. I'll review a few housekeeping items before we get started. The captioning feature is enabled, but you can disable it if you wish to do so. The chat is also available, and we will be monitoring that as well as the Q&A throughout the presentation. So please put any questions or comments there, and we welcome you to join in our interactive discussion today. Also, you will be receiving a survey following the presentation today, and we appreciate your willingness to take a few minutes and complete that to provide feedback on today's presentation and help us plan for future presentations. 2023 is just a few weeks away, and we have a lot of opportunity to present on topics based on your feedback next year. So please feel free to share any thoughts that you have on that. The information that we have in this presentation and accompanying materials is intended for informational purposes only and may not necessarily reflect the views or opinions of the University of Kentucky Human Development Institute or its individual employees. Although we attempt to provide accessible, accurate, as well as current information, we make no guarantees to that effect. So our objectives today are to gain knowledge about asthma as an emerging disability, to learn the importance of access to quality healthcare, lifestyle, and environmental modifications to promote respiratory health and career success, and to hear career preparatory and return to work recommendations that can meet the needs of individuals with asthma. So I am excited to welcome Dr. Rumrill as one of our subject matter experts today. Dr. Rumrill grew up in Vermont and attended Keene State College and the University of Arkansas. Whoops, sorry about that. He is professor of counselor education and director of research at HDI and the University of Kentucky. His professional experience includes substance use counseling, vocational and career counseling, training of rehabilitation counselors, administering research projects related to employment. And his research interests are multiple sclerosis, ADA implementation, traumatic brain injury, employment and disability, aging and health, higher education, and disability. So since this is our last employment seminar series of the year, and I've known and worked with both Phil and Judy Ann for what seems to be from the time we were all children, I thought I would have some fun with the pictures in your bio slides today. So a visual description of the slide is a picture of Dr. Rumrill, I'm guessing at the age of 5 or 6, sporting a circa 1970s polyester sport coat and tie in what I would say is a burnt orange color. And I heard, Phil, that your mom was quite the seamstress and this outfit was one of her creations.
Yes,
I didn't know if you had a comment.
I'm wearing no, my mom did make a lot of my clothes growing up. She doesn't anymore, but I am wearing a polyester sports jacket today and a burnt orange colored tie. So I don't know if it's a different size.
Sounds good. Well, it's a great picture.
I'm glad to be with y'all today, and thanks for. I don't know where you got that photo, but we'll talk about that later.
All right, sounds good. So moving right along, Judy Ann Romeo is also someone that I'm glad was able to join us today. She is the Director of Clinical Operations for Sedgwick, a rehabilitation provider supervising field as well as telephonic staff nationally. Prior to beginning workers' compensation case management, she worked in the rehab field as a detoxification nurse / counselor and has worked in the workers' compensation population since 1997, specializing in catastrophic claims and people with traumatic brain injuries. She's experienced in utilization review for automobile and medical claims and handles catastrophic claims nationally as well as internationally. And she is a subject matter expert on multiple chemical sensitivity, reactive airway disease, and has developed and implemented the ongoing management of COVID programs for multiple companies, including working with long haulers and assisting with the return to work process. She holds her Bachelor of Science in Nursing from the University of Akron, specializing in critical care nursing, and also holds the credential of Certified Case Manager. So in keeping with my theme for biopics, the visual description of Judy Ann's picture is, I'm guessing you look to be about 4 years old, Judy Ann, in your picture, and you're sporting a Shirley Temple hairstyle with lots of shoulder length curls, and a peach colored dress with a lace top. So full disclosure, Judy Ann and I started working together just a few years after this picture was taken. So thank you, Judy Ann, for joining us today.
Thank you for having me as well. And I'm still sporting the Shirley Temple curls as well today.
Good deal. You wear it well. So thank you all for joining us today. At Retain, we have seen people with asthma as a diagnosis or comorbidity, or even as an onset following COVID. So this topic is extremely relevant. We often think of the environment as the main factor that may provoke symptoms of asthma, but people with this diagnosis may also need to be sensitive to physical activities that may produce or exacerbate symptoms of asthma. We're going to start today by asking questions of our subject matter experts, and I'm going to go ahead to the next slide, and I'm going to ask Phil to get us started by talking about why asthma is considered an emerging disability.
Well, thank you, Kimberly, and hello, everyone. Thanks for joining us today. We define emerging disabilities as conditions that are either new to medical science or are increasing in incidence or prevalence in one or more segment of the broader population. And asthma qualifies as an emerging disability under the latter part of that definition. It's not new to medical science, but diagnoses and prevalence rates of asthma are fairly steadily on the rise over the past 15 or 20 years. We just don't know, Kimberly alluded to this, what kind of workout the overall environment is giving our immune systems. And so we see much higher rates of asthma, allergies. Judy Ann could speak about multiple chemical sensitivity, reactions to the environment in various ways, and particularly as it applies to airborne conditions that affect our breathing. We're seeing a real profusion of these kinds of conditions. Asthma is also growing in incidence at higher rates among people of color, among people who live in poverty, people who reside in either rural or urban population density areas. So we're seeing asthma certainly connected with other lifestyle factors, strong association with obesity, particularly in childhood, and as Kimberly mentioned, with the COVID pandemic, we know that if you had a pre-existing respiratory condition and acquired COVID, given the impact that COVID is known to have on lung functioning for many people, people with pre-existing respiratory conditions are at much higher risk for more negative outcomes of COVID-19. So folks with asthma have had to be very careful about contracting COVID in the first place, and when they do have it, making sure they get the treatment that they need.
Thank you for that information. And as rehabilitation professionals and workforce professionals, it sounds like we really need this information to be aware and informed and educated to help serve those people with whom we work. So let's go ahead and Judeanne, I'm going to ask you to take the next question and tell us what is causing people with asthma to exit or leave the workforce.
People with asthma often have exacerbations followed by periods of feeling better. But during the exacerbations, symptoms may necessitate prolonged absences from work, or the individual may need flexibility in their work schedule so they can attend doctor's appointments or participate in other treatment regimens to manage their asthma. This may lead to difficult or strained situations in the workplace. Also, many asthmatics are affected by environmental triggers. And Phil mentioned this previously, but with multiple chemical sensitivities and COVID being so prevalent currently, a lot of those environmental triggers are so prevalent right now. Some of those triggers include chemicals and pollutants and dust and items, and they can be as simple as perfumes or scented hand sanitizers. And we've all seen such an influx of the scented hand sanitizers and sprays and, you know, everything to sanitize surfaces and air, you know, around us. So those are triggers for many asthmatics on a daily basis. And in the era of COVID, we're seeing, you know, that really, you know, rampant with asthmatics as far as the cleaning process, and also in more personal hygiene products than ever before. And that can have a direct effect on many asthmatics in the workplace. And as such, many asthmatics are having difficulties remaining in the workplace due to all the chemicals that are currently being used and that have been used over a period of time.
Thank you for that information. I know you and I had the opportunity to talk about that. And I think one of our first employment seminar series with, you know, the cleaning of the workplace and, you know, how employers and coworkers can be sensitive to other people who may have breathing difficulties, asthma, or reactive airway disease, multiple chemical sensitivities. And, you know, it's really good to be able to hear this information and think about and learn how we may be able to modify utilization of those chemicals or even, you know, personal products so that we don't impact our coworkers and our employees. So thanks for sharing that. And I'm sure we'll talk more about that. But what we're going to talk about next, and Phil, we're going to have you lead the charge on this one, is share the provisions of the Americans with Disabilities Act that relate to the employment and specifically people with asthma.
Well, certainly. And the current regulations of the Americans with Disabilities Act Amendments Act, or ADA-AA, consider asthma to substantially limit functioning in the major life activity of breathing. And that means that if you have a diagnosis of asthma, you are presumptively considered a person with a disability under the ADA-AA. And so you are entitled to those anti-discrimination protections set forth in Title I of the ADA, having to do with employment. So if you work for a covered employer, and that is most public and private employers with 15 or more employees, you have the civil right not to be discriminated against in 41 specific areas of personnel activity. And these range from the advertising of job postings in the pre-hiring process to information on application forms or the job interview process, formulating the job offer, the terms, conditions of employment, which include salary, benefits, opportunities for advancement, on the job travel, things of that nature. You have the civil right not to be harassed or intimidated on the basis of your disability. That all personnel decisions, literally everything in the Human Resources Handbook, has to be administered without regard to the existence or consequence of disability, or in this case, asthma. So people with asthma have the civil right to have everything about their employment situation being operationalized, and all treatment they receive from employers and coworkers has to be done without regard to their asthma. And so that whole fair treatment and equitable access provision becomes very, very important. It's not just enough, though, for employers to avoid proactively discriminating against a worker with asthma. The ADA also requires covered employers to provide reasonable accommodations that allow qualified workers with asthma and other disabilities to perform the essential functions of their jobs. So it's been fairly recently, about 10 years, that people with asthma are considered a presumptive disability group under the ADA-AA, and people with asthma no longer have to go to the trouble of proving functional limitations in order to be protected. So it requires fair treatment in the workplace and the provision of workplace accommodations as needed. And as Judy Ann alluded to earlier, this becomes particularly important and has had some interesting wrinkles in the I was going to say post-COVID, but it's not really post-COVID yet. In the return to office and return to work situation, where there's a big emphasis on sanitizing the workplace, often with chemicals, often with solvents, and breathing those in for people whose respiratory function is compromised can be very difficult. So the way we accommodate, we attempt to accommodate COVID and attempt to make our workplaces sanitary and reduce the spread of infection can actually exacerbate conditions for folks with asthma and other respiratory conditions. So we're seeing some accommodations having to do with fragrance-free policies in the workplace and making sure that people have proper ventilation, things of that nature, can go outside for breaks, et cetera. Judy, and I hope I'm not preempting the next question and set of answers, but we weren't counting on a lot of the COVID responses when we decided to make these protections for people with disabilities in the workplace. And the ADA-AA has really had to keep step in looking at how we're returning to business as usual as a society.
Yeah, thank you. That's great information and very thought-provoking. And you're right, you said keep in step, and as our work environment changes and our response to the pandemic changes, it sounds like we're going to have to continue to change with our response to that. And one of the questions we had specific to that is, who is responsible for deciding what accommodations are needed? So I'm going to go ahead, and I think, Judy Ann, were you going to get us started on that one?
Absolutely. And Phil touched upon this briefly. He touched upon Title I of the ADA, but just to go a little further in depth, Title I of the ADA requires an employer to provide reasonable accommodation to qualified individuals with disabilities who are employees or applicants for employment, except when such accommodations would cause an undue hardship. This guidance sets forth an employer's legal obligations regarding reasonable accommodation. And however, the employer may provide more than the law requires at the same time. So I just wanted to touch upon Title I a little bit further than what Phil went into depth about the Title I, but that would be the answer to that one, Kimberly.
Yeah, thank you. And just a couple thoughts. You know, oftentimes I've seen employers who think that accommodations need to be extremely costly or disruptive, and they may have thoughts or plans as to what an accommodation needs to be for an individual. But really bringing that individual into that interactive process and that discussion is really going to help identify what accommodations are needed, and then the employer can ultimately make that determination as to whether or not it's reasonable. And most of the time, those accommodations can either be no cost or less than $500. And what we've seen is those accommodations not only serve that individual who's requesting it, but oftentimes can also increase the safety, productivity, as well as the morale of all the workers in that environment. And I know Dr. Rumrill has been a pioneer in helping with this, and at Retain, we utilize the tool that you created, the work experience survey, that helps individuals identify what accommodations they may need on the job. And I'll also kind of give kudos to you, Dr. Rumrill, for the win-win approach to reasonable accommodation. And I know you joined us a few months back and shared that information, but those are two fantastic tools that an individual as well as an employer can use, and us as rehabilitation professionals and workforce professionals can use to be able to help people in the accommodations process. So Phil, I don't know if you want to add something.
No, thank you for that. And we do have those materials available, both the assessment tool, the work experience survey, and a plain language, fully accessible version of the win-win approach to reasonable accommodations. We'd be happy to make that available to anybody who might be interested. And I was just going to just amplify a little bit, Kimberly, on what you're saying about the ease and low cost of most workplace accommodations. Our friends at the Job Accommodation Network at West Virginia University have studied this for many years, and the most common workplace accommodation for people with disabilities under Title I of the ADA, since the ADA took effect in 1992, is actually scheduling modifications. Reducing hours, allowing people to work from home, changing shifts around, things of that nature. And more than half, somewhere around 60% of all accommodations used by people with disabilities cost less than $500, and about 25% have no cost whatsoever. And improving ventilation and implementing policies that reduce exposure to chemicals in the workplace would definitely fit into those into the lower cost categories of accommodations. Doesn't require extensive or disruptive renovations and architectural modifications, the provision of technology, things like that. Where those accommodations are warranted, employers would be required to provide those, unless they pose an undue hardship, as Judy Ann mentioned. But even higher cost accommodations compared to the cost of employee turnover. So the opportunity to keep a qualified and capable and productive worker working, the costs of helping people retain employment are really minuscule compared to the costs associated with having people exit from the workplace, particularly in this era of a national labor shortage that we're in the middle of right now. Employers are highly motivated to keep good workers working, because if a person disengages from the workforce, there's no guarantee you're going to be able to find someone to replace that person. So there's a business necessity angle here as well. The employer does make that final decision about what accommodations are implemented, but we always find that it's better for the worker to do everything they can do on the front end to identify what their needs may be. And that's where the work experience survey comes in. It's up to the person, himself or herself or theirself, to make the request for an accommodation. And it's always better if you know what your needs are and what you're asking before you engage the employer in that process. Employers are much more willing to provide accommodations if the worker is specific about what those might be. So doing your homework and negotiating from that win-win point of view is the way to begin that dialogue. So even though the employer does make that decision, it's meant to be a collaborative and non-adversarial dialogue to figure out a way to keep good workers engaged in the labor force. It really is that simple. Thank you.
Absolutely. Thank you. And we can go ahead. I'll send out the those resources to everyone who's joined us today, just so you have those in case you don't already have those on hand. So as far as employment resources, what are available for individuals who have asthma? And I think Phil, you talked about some of those a little bit, but do you want to get us started?
Happy to do that, and bear with me, folks. I'm phoning in today, and I'm muting and unmuting is a little more complicated a task than I'm up to this afternoon. We always begin with our colleagues at the Job Accommodation Network. And Kimberly, I don't know if we have posted, if people can see the link to these resources, or if we can.
I can definitely put those in the chat.
Get them to folks, yes. So this is a project funded by the U.S. Department of Labor continuously since 1984. They receive about somewhere around 2 million hits per year to their website and their toll-free technical assistance line to help workers with disabilities, employers, rehabilitation professionals, anyone who's interested in the employment and inclusion of people with disabilities in the workplace can visit this free service. And it's all about accommodations in the workplace, including technology. They have filters where you can put in asthma, and they have a database and repository of accommodation suggestions they've made to help workers with asthma in their direct consultation with workers and employers. All manner of information on ADA and ADA AA implementation, including the process by which you identify and implement accommodation, what you do if you feel you've been discriminated against at work, et cetera. Information on starting small businesses for workers with disabilities, and links to many other resources. So it's a tremendous national level resource and available free of charge. Another excellent one does related work is the ADA Centers National Network. There are 10 regional centers across the United States. Again, toll-free access as well as a website. We can get you the link to the main website for the overall network. I think it's adata.org. Also, tremendous information about ADA implementation, including workplace accommodation. They work in conjunction with Jan on many projects as well. So this is an excellent resource. And if you tune in to the ADATA or make a phone call, it will route you directly to the ADA center that is nearest you. We also commend to your attention the Office of Vocational Rehabilitation in Kentucky. The State Vocational Rehabilitation Program goes by different names in different states, but this resource provides free vocational training and employment preparation assistance to people with disabilities. Not a means-tested program, so you don't have to qualify other than to have a disability that has a potential limitation to your ability to work. Very important resource. You can enroll as a consumer of the state voc rehab program, driven by a individualized plan for employment. But the OVR offices in Kentucky also have excellent technical assistant resources as well. Those are three that I would mention, Kimberly, and we'd certainly be remiss if we did not mention our statewide Retain Kentucky project, and I know you'll want to share some information on that as well.
Yeah, absolutely. And I've seen our return to work coordinators in action, helping people and people with the diagnosis of asthma through Retain Kentucky. So please keep us in mind. And I'm going to talk about our eligibility criteria here in just a second. I know we're right up against our time, but Judy-Ann, any other resources that you may want to add to this?
Absolutely. For those individuals that, do have a diagnosis of asthma, multiple chemical sensitivity, or reactive airway disease, RAD, they may just want to plug into the American, the American Lung Association, or even their pulmonologist. So those would be two individual resources for them to use as well.
Great, thank you very much. And we'll just wrap up very quickly here. And as a reminder, we can help individuals who are a Kentucky resident, currently employed, or have worked in the last 12 months and have not applied for or are receiving SSI or SSDI, and their injury or illness is not work-related. So we can help them. We've helped people with asthma secure disabled parking permits, negotiate job accommodations, get reduced costs for prescriptions, and even learn to identify and avoid environments that exacerbate their symptoms. So we are looking to serve over 3,000 participants throughout the Commonwealth. And if you know of anybody, please send them our way. They can call us, they can email us, they can visit our website. They're all listed here, or use our QR code, our participant screener, that allows them to answer our eligibility criteria and then takes them to one of our intake coordinators to start that process. I'll go ahead and send this slide deck out to everybody that's joined us today. I don't see any questions or comments in the chat or QA, but I'd like to thank all of you for joining us. I'd like to thank Phil and Judy-Ann for sharing their expertise. It's really fun to spend some time with both of you, and I hope everybody has a great holiday season, a healthy and happy holiday season, and we'll send out our list of topics for the Employment Seminar Series for Retain Kentucky for 2023.